The evolving stream of COVID-19 information has created questions for many of us. We recently sat down with Dr. Jeff Carson for a Q&A session to help fill in the gaps. I spent considerable time with someone in the days just before they tested positive, but my test came back negative. Does that mean they can't get me sick?
Well, there are two possible explanations for why your test is negative. First is the tests are imperfect. That is, they only have about a 70% sensitivity, which means that about 30% of people will have a false negative test. The second reason is not everyone gets sick who's exposed to those who had COVID. It's somewhere in the range of about a third, but of course it depends on the nature of the exposure. Did someone cough on you? Were you really in close contact? Or were you just in the same room and separated and the person wasn't coughing, as an example? So there's a great deal of variability, and you can't really distinguish whether it was simply that you did not get enough exposure to the virus and therefore didn't get sick, or whether your test is falsely negative.
How effective are the two approved vaccines? Is there anyone that should not be vaccinated?
The two vaccines are excellent vaccines. The data suggests that they're 95% effective. That's remarkable. Basically, we advise almost everyone to be vaccinated. The only groups that are recommended not to be vaccinated are those who are allergic to components of the vaccine or had an allergic reaction after the first injection.
I understand there can be side effects. Should I wait for more studies?
No. I normally, when it comes to new medications or vaccines, want to wait at least 1 to 2 years before using it in my patients. This allows me to gather more information about the side effects of those particular agents. However, in this situation, that would be a mistake. And it really gets down to simple risk versus benefit. The benefit so far outweighs the risk because of the severity of this illness, the fact that it leads to significant mortality in some people, and of course is highly impactful on our community, our colleagues, and our family. When you look at the short-term data, it appears that the risks are quite low. And while we do not have good information on long-term side effects, they are likely to be reasonable. And in the end, the current best judgment is that the benefits far outweigh the risk.
So how long did it take for protection to ramp up after receiving the vaccine?
About 2 weeks. When you look at the curves from the clinical trials and you look at the number of new infections after 2 weeks, they're remarkably few. No doubt that the immune response is greater after the second shot, and it may be that it's longer in duration, although we don't know that at this point in time. Clearly, you want to continue to be careful, though, because even though these vaccines are terrific, it's somewhere in the 95% range effective, it still means that some people will get infected even if they've had the vaccine. So you're not 100% protected, but you certainly have very significant protection, but it means that you still should not let your guard down. You still should be social distancing. You still should be using a mask and, of course, washing your hands frequently.